For today's class, we are going to talk about disorders of the urinary system. We'll begin by looking at cystitis. Cystitis is inflammation of the urinary bladder. Now, this is most commonly caused by the bacteria E. coli. E. coli is something that is normal to live in our intestines, can cause infection if it travels elsewhere in the body, and if it travels to and it gets to the urinary bladder, it can cause this inflammation. The symptoms of cystitis include things like dysuria, which is a term for pain with urinating. It also can cause increased frequency, so going to the restroom more than usual. This can be more common in females just simply because that your urethra, which is that tiny tube that connects the urinary meatus to the bladder, is shorter, and so females can be more prone to getting cystitis. And because cystitis is most commonly caused by a bacteria, again that bacteria being E. coli, then the treatment for it is antibiotics. The next condition is enneresis, and enneresis is the term for bedwetting. Now, this is something that can be normal in that it's part of normal childhood development, and that's up to the age of 5. But after that, then that could be a cause for concern. However, most children do outgrow bedwetting on their own. The next condition we have is glomerulonephritis, and as this term indicates, it is also an inflammation, and this is inflammation of the kidney because the glomerulus is an internal structure of the kidney. Glomerulonephritis can be acute, meaning it can develop suddenly and be something that's temporary, or it can be something that is chronic, meaning it can be more long-term. Acute glomerulonephritis may occur after things like a strep throat or other types of infection. However, chronic glomerulonephritis is going to develop slowly over several years, and this is a complication that can lead to the kidneys not being able to work effectively, which would be termed kidney failure. Incontinence is a condition where an individual loses the ability to control the release of urine. And simply put, urinary incontinence is the loss of bladder control. There are different types of urinary incontinence, things like stress incontinence. This is when urine leaks when you put stress on the bladder, and this can happen during things like coughing, sneezing, or even laughing. Temporary causes of urinary incontinence can also be alcohol, or consuming too much alcohol, or having too much caffeine, as they are diuretics that inhibit the reabsorption of water. Persistent causes of incontinence can be things that happen with childbirth, an enlarged prostate in men, and also just normal changes with age. Next we have renal calculi, and this is the term for kidney stones. These stones are made of crystals of calcium phosphate, or uric acid. And they can be a problem because when they get large, they can block the ureters. Remember, the ureters are the tubes that extend from the kidneys to the bladder. Causes of kidney stones or renal calculi can be things like certain foods in the diet, like certain fruits and vegetables can have a higher calcium content and can increase the risk of getting calcium stones. Eating a high protein diet can increase the risk of getting stones from uric acid. excess body weight in some medical conditions can increase the likelihood of developing renal calculi. Also, another example would be repeated urinary tract infections. So those are things that can lead to kidney stones. What are the symptoms? So for initial symptoms with kidney stones can be severe pain, and these can be quite painful if you hear someone say that they passed a kidney stone, that is associated with severe pain. Other symptoms of renal calculi include things like nausea, vomiting, frequency, meaning increased urination frequency, chills, fever, and hematuria, which is a term for blood in the urine. The diagnosis of renal calculi can be done by symptoms. It can also be done by an ultrasound or through imaging with X-ray. The treatment for renal calculi include trying to either flush the stone out with fluids, medications, and lithotripsy. Lithotripsy are when shock waves are used to try to break up the stones so that they can become removed. And the last disorder of the urinary system that we'll talk about today is the most severe, which is renal failure. Renal failure occurs when your kidneys lose the ability to properly function. So because the kidneys can't function like they should, your blood is not going to be filtered as it should. Different things can lead to renal failure. Some of the more common causes can be things like diabetes. Diabetes can cause damage to the blood vessels in the kidneys, which can lead to kidney damage. And also high blood pressure. High blood pressure can cause the arteries around the kidneys to narrow, weaken, or harden, and then these vessels aren't able to deliver blood to the kidneys like the kidney needs, and that can cause kidney damage, and damaged kidneys don't filter blood as well, and that can lead to renal failure. Now, an early sign of renal failure is oliguria. This is when there's a very small amount of urine output because, again, those kidneys aren't able to filter like they should. Now, renal failure can be acute or chronic. So acute is going to be like this sudden onset, something that's generally going to be temporary because it's often reversible, and it can be caused by things like injury, illness, or even certain drugs. And chronic renal failure, this is something that's going to be long-term. It usually occurs over months or years, and it can be caused by long-term disease, as I stated, with high blood pressure and diabetes. And this one is normally not reversible. Now, with renal failure, it's staged, and the stages go from 1 to 5. So 1 being the kidneys having the highest amount of function, and 5 being the kidneys having the least amount of function. When the stage 5 is reached, then at this point the kidneys are not able to filter the blood properly. This is called end-stage renal disease, and this is where dialysis, which is using a machine to do the job of the kidneys, or a kidney transplant is going to be indicated. Now, the different stages for renal failure are based off of what's called glomerular filtration rate. So remember, we talked about glomerular filtration that happens in the glomerulus, where the glomerulus is going to filter out that blood. And because of that, glomerular filtration rate can be used to measure your kidney function. And so the higher the percentage, so the higher the glomerular filtration rate, the less damage to the kidneys, and then the lower the glomerular filtration rate, that means the kidneys are not working as well as they should. And if an individual does reach stage 5 of that renal failure, the kidneys are not able to do their job, and this is where either a transplant is going to be indicated, or a machine is going to be used to filter the blood for the patient. And this is called dialysis. Dialysis serves as substitute kidneys. It involves the passage of blood through a machine that has this semi-permeable membrane. So you can think about how in the glomerulus, how those capillaries act like this filter. Well, the machine has this semi-permeable membrane that is used to filter the blood. This is something that in some instances can be done at home. It's often done in a clinic. It is a lengthy procedure. It can take 2 to 4 hours, and it has to be done regularly 2 to 3 times per week in order for the patient to be able to function. And that does conclude today's class on disorders of the urinary system.